Good morning, everybody. Can I start by wishing everybody, all fathers, a happy Father's Day, and no doubt next year's Father's Day will be celebrated much differently to today, and I think we all appreciate that very much. Pleasingly, New South Wales has now officially reached 40% fully vaccinated in terms of our population. That's an incredible milestone to have reached it, given where we were just a few months ago. So thank you to everybody who's come forward and get vaccinated, and we have 73% of our population with a first dose. Once we hit 80% first doses, we'll have confidence that we're going to get to the target of 80% double dose. Not very many places around the world have done that, and I'm convinced we'll do that here in New South Wales. To 8 p.m. last night, we had 1,485 cases of COVID in the community, and regrettably, we lost 3 lives due to COVID or patients with COVID in southwestern and western Sydney, and we extend our deepest condolences to their families and loved ones. Today is a special call out to everybody in those local government areas of concern. If you're an emergency services worker, any other authorised worker, come forward and get vaccinated. There's special accommodation being made for you, and we're really keen to see those vaccination rates go up, especially in those areas where we know there's a high viral load. But we should also remember that whilst we're anticipating the peak of cases to occur in the next couple of weeks, we can definitely foreshadow that once we hit that 70% double dose, that life will feel much better in New South Wales. Those of us that are vaccinated fully will be able to participate in things that we've missed out on for a long time. So thank you to everybody for following the health orders, for getting vaccinated, and most importantly, for working with us as we head towards living with COVID. Dr. McAnulty will now give his update, and then we'll take questions. Thank you.
Thanks, Premier, and good morning, everyone. Just to give you an update of the numbers from yesterday. There were 1,485 locally acquired cases of COVID in the 24 hours to 8 o'clock last night, and 2 overseas acquired cases in that period. There were 115,495 tests reported at 8 o'clock last night, compared to the previous day's total of 131,174. There are currently 1,030 people admitted to hospital, with 175 in intensive care, 72 of whom require ventilation. Sadly, as the Premier mentioned, there were reporting 3 deaths today of people with COVID. A woman in her 50s from Western Sydney who died at Blacktown Hospital. She received 1 dose of COVID vaccine and, as we understand, had no comorbidities. A woman in her 70s from southwestern Sydney who died at Campbelltown Hospital. She was not vaccinated and had significant comorbidities. And a man in his 70s from southwestern Sydney who died at Liverpool Hospital. He was not vaccinated and also had significant comorbidities. And we extend our deep condolences to the families and friends of these 3 people. We've had a number of pings go off with our ongoing sewage surveillance system in regional areas. We'd like to call out people in these areas need to be very aware of symptoms, come forward for even the mildest of symptoms of COVID should they get any cold-like symptoms. We've had a detection in Byron Bay overnight, and recently in Tamworth and Glen Innes in Hunter, New England, in Cooma in southern New South Wales, and West Kempsey on the mid-north coast. So please come forward for testing if you have any symptoms at all. The suburbs in Sydney that we're most concerned about continue to be around southwest Sydney and western Sydney, with Guildford, Auburn, Merrylands, Greenacre, Laguna, Liverpool, Georges Hall and Bass Hill the highest numbers of cases in the last day. In regional New South Wales, I'll just go through the cases reports we've had yesterday. In Western New South Wales, the Western New South Wales Local Health District had 32 new cases of COVID. This brings a total number to 791. And yesterday's numbers were 23 in Dubbo, 3 in Burke, 2 in Orange, 1 in Cabone, 2 in Blaney and 1 in Narromine. In the far west, 4 cases were reported yesterday, 1 in Broken Hill, 1 in Wilcannia, and 2 in Balranald. However, they're under further investigation as they may be false positive, but we don't know yet. In the Hunter, we've had 12 new cases in the Hunter to 8 o'clock last night, bringing the total to 228 since the 5th of August. Of those, 7 are in Port Stephens LGA, 2 are in Maitland LGA. One is from Armidale, however that one is under further investigation as we think it may be a false positive. One is from the Upper Hunter Shire and one is from Cessnock. In the Illawarra, we've had 11 new cases reported, 8 in the Wollongong LGA and 3 in the Shell Harbour LGA. And in the Central Coast, we've had 7 new cases, bringing the total in that LGA to 100. It's important to note that we're seeing cases among all ages, but 2/3 of our cases have been in people under 40 years of age. So the message about coming forward to testing, but also getting vaccinated, taking the advantage of the multiple vaccination hubs and through your GP or pharmacy to get vaccinated remains so important. Thank you.
Premier, good morning. Labor is calling for the end of the curfew in the local government areas of concern. What do you say to that? Are we going to see an end to it soon?
I'd be interested to see what health advice they got that from or what the advice is, but obviously we have to follow the advice we have. We know the next few weeks are likely to be the most difficult, and wherever we can ease the burden of our citizens, of course we will, and that's always been our case. Always been the point we put forward that we all only ever put in restrictions when we absolutely have to, and we appreciate the enormous stress it causes families.
But does the health advice say that it is actually having a positive effect on cases right now?
Look, we confer on a daily basis with the health experts, and last week when I was able to advise of unlimited exercise for those areas of concern, that was based on advice I received directly from Dr. Chant. So whenever we get any advice that gives us the green light to proceed on those matters, we will. But we have to appreciate also that this is the most critical time in dealing with the disease for us, and I'll be providing further detail this week. But all the modelling indicates to us the peak is likely to be here in the next week or two, and then the peak in hospitalisation and intensive care is likely to be with us in October. So we know the next few weeks are when the case numbers are likely to be the highest. But what we don't want to see is if you make too many interventions at the wrong time and there's a surge in cases, it sets us back. So the modelling is only as good as all of our behaviour and all of us getting vaccinated. It's based on the fact that we'll keep coming forward to get vaccinated. It's based on the fact there won't be superseding or super spreading events we don't anticipate. So we know the next few weeks are absolutely critical, but if we get any advice that gives us that indication, of course we'll take it. However, we have to all appreciate when we get through the next few weeks, all of us will feel much more assured about how we'll cope in October. And what I have my eye on is, of course, the 70% double dose vaccination, which will ensure all those freedoms that those of us that are vaccinated will enjoy.
Premier, you talk about... Sorry, thanks. You talk about, we're going to peak in the next week or two. Are we expecting to see cases, hit 2,000 perhaps this week?
Well, look, as I said, I'll present the modelling this week, which will include not only what is foreshadowed to be a peak in cases, but also the peak in hospitalisations, the peak in intensive care. They're all relevant factors. Obviously we're keeping a keen eye on the people that have to have intensive care, but we also have great resources in terms of our surge capacity, and clinicians and other health experts will be providing that advice directly to the public so that everybody feels confident that we have the capacity to deal with what's going to come our way in the next few weeks. So it's really important for us to be as open as transparent as possible, but we also want to be clear that the modelling changes every single day. There's so many variables in it. So the day that we provide the information will be our best information for that day, but please know that you base your modelling on the best advice at the time, which is exactly what we're doing, and we look forward to providing information to allow the public to feel absolutely confident that yes, our system will be stretched. Will we be doing things differently? Of course we will, but that's why you put pandemic plans in place. That's why you make sure you have the capacity in the system, and every day we've provided upfront information about how many people are in hospital, how many people are in intensive care, how many people are being taken care of in the community, but obviously the higher the rate of vaccination, the better protection we have against people ending up in hospital.
Premier, the Federal Minister Stuart Robert today said on TV that the national plan, including targets of 70 to 80%, is malleable, that it is subject to change. Is that your understanding? And if that isn't your understanding, would New South Wales go it alone?
Well, look, it's always been the case that when you hit 70% double dose, you can give freedoms to your community that otherwise weren't there. But what New South Wales looks like at 70% double dose might be different to what WA looks like, and I think that's what the Federal Minister was referring to. So in WA, for example, where they have no cases, they may want to keep things obviously the same, that they don't have any restrictions in place at all. Whereas in New South Wales, if we're at 70% double dose vaccination, we're going to have QR codes, we're going to have density rules, we're going to make sure there's good social distancing, caps at events. So that's the point. This is why the national plan works well, because every state is able to open up depending on what's going on in their state at the one time. There's no doubt we'll have many more freedoms than what we do today, but every state might look a bit differently as to what it's allowing at 70% double dose, and that's been part of the national strategy from the beginning, and it's part of the Doherty Research Centre's planning as well, because the Doherty research paper tells us that you have various restrictions, restrictions is the wrong word, but various conditions you can still have in place to make sure you safely reopen. And this is the difference between Australia and other countries around the world. When other nations got to their vaccination targets, they didn't have any rules in place, and that's why case numbers surged, and that's why some hospital systems were overwhelmed. And in Australia, we have a very different approach. Our approach is once you get to those high and safe rates of adult vaccination, you open up in a staged way, you open up in a safe way, and that's exactly what New South Wales will do.
Minister Robert was actually talking about the thresholds for an end to the lockdown at 80% double dose vaccination. This goes to the issue that Anastasia Palaszczuk raised the other day when she was talking about the need for under 12s to be vaccinated. Minister Robert said that the framework at 80% double dose could shift and change. Is that the indication you got in National
You're
Cabinet?
asking me questions about an interview about someone else I haven't heard.
About National Cabinet?
But what we do know is what National Cabinet decided. The Doherty paper is on the public record. All the information is there. The Doherty research paper at what you can do at 70% and 80% is based on the rate of adult population, 16 years. Well, it actually includes 16 years and over, and that's exactly what New South Wales is working towards.
Did you get updated modelling from the Doherty Institute, which took into account the thousands of cases that New South Wales is experiencing? Because there was going to be updated modelling.
If we did, I can't disclose what's discussed at National Cabinet. Suffice to say that New South Wales is tracking extremely well in terms of our 70% double dose rates, and tracking well in terms of us preparing our roadmap for what life looks like at 70% double dose, and we anticipate hitting that at around mid-October. I just encourage everybody to keep coming forward and getting vaccinated. I know I sound like a broken record, but with good reason, because once we get those vaccination rates, life will look much better and feel much better, and we certainly won't have to have a statewide lockdown ever again once we hit those 80% double dose vaccination rates, and that's what we're looking forward to.
Premier, you say life will look better. We've seen this morning in terms of the Socceroos fixture, I mean, the Everest, life starting to open up. How will life look in October and November? What are you anticipating?
Well, I've been pretty clear to say that at 70% double dose vaccination, you'll be able to get a meal if you're fully vaccinated, able to attend events, able to do things you can't do now, access services. But we're working on the roadmap now. We're consulting with industry. Obviously, the health experts are giving us advice on what they think is a safe way to reopen at that stage as well. So it's important work we're doing, but work we look forward to presenting to the public as soon as we have ready. And in the first instance, though, I want to make sure every single citizen understands the plans we have in place for the next few weeks, when the hospitalisation numbers are going to increase, and when ICU capacity will also need to be stretched, and we'll obviously provide that information as early as possible, but also our best modelling. But I want to stress that when these figures do come out, they're only as good as that day, because there's lots of variables that can go into that. But it will give everybody a really good indication of what we're expecting, but also what we're prepared for. And can I give everybody an assurance that what we've prepared for and what we think is going to happen, there's a big gap in that. So there's what we have to say in relation to that is that there will be strong evidence to give the community information that we are well and truly prepared. But having said that, we know how difficult it's going to be for all of our frontline workers, for families who are dealing with loved ones who've got COVID. So the best protection is to stay at home unless you have to absolutely leave your house if you live in those areas of concern in particular, and also to get vaccinated. Sorry, you've already asked the question.
In terms of the extra Pfizer coming, where will that be prioritised to? Which areas or groups?
Now, look, we're still focusing on making sure we provide vaccination to people living in those areas of concern. because we know that the most authorised workers are actually coming out of those areas of concern, and that's where the virus is spreading most of all, in workplaces and then people taking it home to their families. So that's not changed from day one. And if we want to see those rates of cases decrease, if we want to see the rate of contagiousness reduce, we have to make sure we vaccinate people in those areas of concern as a priority. But we'll also be making sure that the vaccination strategy is targeted to key groups, to key vulnerable groups, key professions. But come October, supply won't be an issue. So it's really about how we manage the vaccination strategy for the next 4 weeks. And I was very pleased when the Prime Minister announced extra doses, of which New South Wales will get their share, because there was going to be a gap in supply in September, and now to some extent that's been closed, which is positive. And so we look forward to people coming forward and getting vaccinated.
Premier, obviously today you're targeting emergency service workers with vaccinations. Shouldn't the majority have already been done?
Exactly.
Yeah.
Yes,
Do you have any information
no,
on
the majority.
rates?
We are targeting emergency service workers today. The majority have been done, but remember, people come into the system all the time. So there's always new people coming in. There are people learning or studying or still students in various professions. So we are targeting emergency and healthcare workers today in those areas of concern, but knowing full well the vast majority have been vaccinated. For example, all the police that were involved in the quarantine system were vaccinated some time ago, as were the vast majority of our health and aged care workers, but we don't want to leave any stone unturned. And so we're asking, if you volunteer in emergency services frontline, or you haven't been vaccinated yet and you work for any of those frontline agencies, please come forward and get vaccinated. And I'm told there are still vacancies available today, so you can hop online now, newsouthwales.gov.au, and get your jab by the end of the day.
The health order mandating a first dose of vaccination for authorised workers in the LGAs comes into effect tomorrow. There's potentially going to be thousands of employees, though, who haven't been able to get a jab or don't have one. Are you concerned that there's going to be massive shortages in critical industries because people won't be able to go to work because they haven't been able to get a vaccine?
Oh, look, I understand that consultation is occurring now with the possibility of extending that time frame. We've given some occupations until the end of the month to get vaccinated, so I understand there's some industry consultation now about what that might look like.
You're going to change it, Premier?
I'm sorry?
You're going to change it?
Oh, the health officials are having those conversations. Yeah.
Premier,
I'll come back to you in a second.
obviously there's a lot of mental health concerns about the community. I know you don't like talking about yourself, but have you adopted any personal measures to keep yourself sane? How are you coping personally? Are you working 7 days a week? Do you work from home? Do you have some kind of regular routine you do?
You don't really have time in my job to worry about those things, but I mean, that's why we look closely at to make sure everybody has adequate opportunity to exercise and get fresh air while the weather's good. So I just encourage everybody to make use of the easing of the restrictions that we've provided in the last few weeks. And from next Monday, the community will be able to also have a slight easing of restrictions in those areas of concern, but also outside those areas of concern. So we just ask everybody to be mindful of their health and wellbeing. The health orders that we have in place, the health rules we have in place are a balance. They're a balance of making sure the virus doesn't spread beyond our ability to take care of people, but also looks at the health and mental wellbeing of everybody. But we do want to make this point, I really want to make this point clear, as far as dealing with the worst bits of the virus, even though the intensive care capacity will be our biggest challenge in those first few weeks of October. October is the month where all of us will feel relief. All of us will feel that we're on the home stretch, and certainly we almost feel that now. Once we get over the peak of number of cases, I think people will feel much more positive about the next few weeks. People will start turning their minds to starting to prepare children to get to school. People enjoying those things in life we haven't been able to do for a long time. It has been a difficult time, but also one in which we've done as well as we can to protect life, to ensure well-being, and also to minimise what we're doing to the community.
Could you give just one little anecdote about your own personal...
Not really. It's not. I don't think people care.
Premier, regarding the areas of concern, would you have a problem if local swimming pools reopened, given the weather's getting warmer?
Oh, look, that would depend on the health advice, and I suspect there'd be a lot of rules around that. So, health is looking at all those situations. The middle of October will be here before we know it. So, if you think about the rates of our vaccination program, and how well New South Wales is doing. I'm so pleased with the way the public's responded. We don't have that too long to wait before that happens. And I know it's always the end bit that's the most frustrating bit for people to get through. But winter was horrible. Spring will be much better, and I'm looking forward to the next few weeks where we'll start having conversations about what people can look forward to, and also obviously what life looks at 70% and 80% double dose.
You said you were talking last week, Premier, about moving the state forward together in terms of the easing of restrictions. Does that mean that people in hotspot LGAs will get the same freedoms that other people in Sydney will get when we reach 70% double dose vaccination?
Look, as much as possible, our policy has always been as much as possible two things. Firstly, not to burden our citizens any more than we need to, and secondly, to have all of us moving together forward together. But obviously, you need to check the health advice. And in some parts of regional New South Wales, for example, we'll be making a decision this week as to, what happens to the regions post the 10th of September, because their lockdown technically goes to Friday. So obviously these are all considerations we do on a daily basis. But the two principles which guide us are firstly, not to burden our citizens any more than we need to, but secondly, where possible, to have the rules consistent across the state as much as possible as well.
Premier, given where we are in this...
Sorry, I'll come back to... Yeah.
Given where we are in this outbreak at the moment, in your personal opinion, do you still think it's fair that people coming from overseas who are fully vaccinated and return a negative test have to go into hotel quarantine?
Well, that's why I made quite pointed comments last week to say at 70% double dose and 80% double dose, we'll go through a transition in how we deal with the virus. That includes how the quarantine system looks, that includes how we do tracking and tracing, and how we treat patients. So there's a whole range of things which we'll be transitioning from once we hit 70% double dose. And I think the current quarantine system has nearly reached its use-by date in terms of how effective it is. It's been great whilst we've had it, but when you have 80% double dose and Australians are coming back home fully vaccinated with a credible vaccine, which our health authorities deem to be credible, it would make sense that they be allowed to quarantine at home. And so we are already considering when we do that and how we do that, but the transition will start in earnest once we hit 70% double dose. But the planning work has already started. We've already started planning to see what life looks like for Aussies coming home when they're fully vaccinated. We'll still need some form of quarantine, obviously, whether it's in the future for international students or skilled labour. There'll still be some requirement for quarantine. But as far as Australians are concerned, if you're fully vaccinated with a credible vaccine, you should be allowed to quarantine at home, and that's the transition we'll be making.
What about the people arriving for example, the Socceroos match? I mean, will there be a biosecurity bubble within that contingency, the players, staff, etc.?
Yeah, I'm not sure what the date. I'm not sure about the dates and what's involved there, but until we hit 70% double dose vaccination, all current arrangements are the same.
Post 70%. Post 70%.
Right, post 70%, obviously.
Will be quarantined, or will they be given an exemption?
Well, if they're Australians who are double dose vaccinated, we're obviously working on plans for what is a safe way to quarantine people who are Australian and who are fully vaccinated. But for everybody else, there'll still be different requirements.
Sorry, what's the plans to change the rules?
No, we're currently going through the planning work now to determine when we will allow Australians coming home who are fully vaccinated to vaccinate at home. So the planning work is happening now. Definitely will occur by 80% double dose vaccination. And the rate we're going, we only anticipate a couple of weeks between 70 and 80% double dose. If we get to 80% first dose in the next week or two, I'll have confidence that there'll only be a very small gap between 70% and 80%. And that's why I'm really urging people to come forward and get vaccinated. The more of us that get vaccinated in the next week or two will determine when we can get to 80% double dose. And that's really what we have a keen eye for. And of course, anything above 80% would be a bonus. It would mean that so many people are protected and children would be more protected. So it's really important for that to occur.
The Prime Minister has basically promised that families will be reunited over Christmas, but yesterday Tasmania said they would be waiting until 90% vaccination, or they strongly implied 90% vaccination before opening up. Do you have a message to other state or territory leaders who might have not agreed to this 70-80% or who are maybe backflipping now?
Oh, I think all of us want to see Australians reunite with their families and have a Christmas as we've enjoyed in previous years. So that is definitely what New South Wales intends to do for our citizens. and I hope that other states obviously have the same approach, which is what is in the national plan. Once we hit 80% double dose, by that stage, definitely all internal borders in Australia should not exist. And by that stage, New South Wales would welcome home thousands of Australians every week. Because when you have 80% of your population, adult population, completely vaccinated, it does allow you to do things differently. And I look forward to Sydney Airport welcoming home Australians from lots of states. If other states don't want to do it, we're happy to do it. And also having opportunities for our citizens to consider overseas trips or joining relatives overseas or job opportunities. Well, we want them to have job opportunities here, but obviously that opportunity to travel. So New South Wales is definitely in that space. That's what all the states have signed up to. And I'm confident. I mean, New South Wales has had to confront some issues because our major outbreak happened first, but other states are all going to have to go through this. Victoria's going through what we went through. If you follow the rate of their cases at the time that we had ours, you will see the pattern there. Every state's going to have to go through this, and that's why we've had the opportunity to actually be confronted by what we're going through, and that's why we've come to the conclusions we have. And I'm confident every other state leader will come to the same conclusion, that is, we have to stick to the plan. It's in the best interest of our states, but also our nation, our Australian citizens. Most people don't see boundaries within Australia. Most people want to reunite with their families, and that's exactly what we'll be working towards.
You're talking about another 6 residents of a nursing home in Revesby Heights have all tested positive. Are you surprised workers are still unvaccinated?
Oh, well, look, it's obviously disappointing that that's the case. As you know, the state government has stepped up to assist in that process. And there's no reason why anybody working in healthcare shouldn't be vaccinated. In fact, the New South Wales government, through the Health Minister, signed the health order recently about mandating all healthcare workers to be vaccinated, and we look forward to that occurring.
What's the hospitalisation rate currently from the Delta strain, including people who are getting hospital in the home treatment?
Right, well, as you know, every day and every week we give out what's called our reports, which have all those figures in there. And we'll be updating those this week. But as you know, someone from the public health team reads out the number of people in intensive care and hospitalisation. We have around 1,000 people in hospital, around 170 in ICU, and about 11,000 being cared for in the community or thereabouts. So they're roughly the numbers, but obviously we'll provide further detail at the end of the week, but also when we provide that detail about the modelling and where things are at. And remember, the rate of hospitalisation also relates to the case numbers and vaccinated people, all those things. So the case numbers into the future will be less relevant, as I've said. The number to look out for is how many people require hospitalisation and how many people require intensive care, because if you don't need to be in hospital, that means your COVID case is being managed. You might be fully vaccinated with the disease and fine at home. And obviously, if you need oxygen, you'll be taken to hospital. That's why we're asking everybody, if you have breathlessness, if you have those severe symptoms, don't hesitate to call an ambulance and go to hospital.
Premier, in the EPI report, it says the most recent one, in the week, or since 16th of June, 11% of cases have been hospitalised. That's a bit different to the 5.5 that you mentioned the other day.
So I can't hear your question.
11% of hospitalisation
Right.
rate according to the EPI report, the most recent one.
Right.
That's a bit different to the 5.5% you said
Oh,
the
look,
other day, isn't it?
it differs from week to week, and it also depends on the rate of vaccination and where the cases are coming from and the age group. So we provide a weekly update to those figures. But what we want to do this week, which is what we will do, is provide the community assurance that even when we anticipate a worst case scenario of the number of people who are likely to require hospitalisation and intensive care, that our system has already made the plans for that surge capacity. And you won't need to hear it from me, you'll actually hear it from the clinicians, the people that put the plan together, and why it's a good plan. But it doesn't mean we're not going to be stretched. It doesn't mean our frontline workers aren't going to be stressed, and it doesn't mean that things will be done the same. We have to do things differently in managing a pandemic. We can't pretend that the rules that exist for our health system are going to be the same when we're in the middle of the worst bit of a major outbreak in a pandemic. So we just want to make clear what people can and should expect over the next few weeks, so there's no surprises, and also the confidence that if you do the right thing, there's no reason why you'll end up in hospital. I shouldn't say that, because sometimes obviously Delta Delta doesn't provide the symptoms, and people don't even know they have the disease until the symptoms are made available. But I say this, that if you stay home and you're vaccinated, chances are you won't need hospitalisation. So we just ask people to consider those, to do the right thing, and to feel confident that the health system is there to take care of you.
Premier. Job description is reassurance, saying the hospital system will be fine. We even to expect the surge, as you described, in the coming month or so. We know of a case where a woman had to discharge herself from hospital despite having a broken back because she claims she was put among COVID patients and wasn't seen for hours. If there's going to be a surge in the next month and we're not coping now, how do you expect we're going to cope in the future? And the real question is, are we going to cope?
The short answer is absolutely. In terms of that case, that's the first time I've heard of that case. But as I said, you don't need reassurance from me. You'll get it from the clinicians themselves who've put the plan together. So we have experts throughout our system that have been working on this plan for 18 months. And they will be frankly and directly talking to you about the plan and what we expect. And how we will have to do things differently because we're not in a typical situation. Our health system is the best in Australia, but even in the absence of a pandemic, it has bad days. All health systems have bad days, but in the midst of a pandemic, we can all appreciate what that would be like. But having said that, the resources are there, the planning's there, the staff are there, and we'll provide that information in detail this week.
Premier, you talk about the conclusions that you've come to here in New South Wales as the leader, and you use some really strong language about opening up at 70 and 80%. And there's a big group in the population who, yes, want to get back to work, want the kids going back to school. There's also another group who are deeply uncomfortable with opening up and deeply uncomfortable that people die and hospitalisation rates. How are you going to govern for those people when there's such a divide now happening in the state?
Well, I don't think there is such a divide, and it also comes down to personal choice. If you're fully vaccinated and you have the opportunity to go and get a meal outside, you don't have to if that doesn't make you feel comfortable. It'll all be about choice. But the choices will only exist at 70% double dose for those who are fully vaccinated, and also at 80%. There'll always be things you can't do unless you're fully vaccinated, but it comes down to choice. If you don't want to be fully vaccinated, that's your choice. You just won't be able to participate in things. And you can never ever, I would never ever on behalf of the government make a decision where I expected 100% of people to be happy with. These are challenging times, but what you do need to do is make decisions that the vast majority will benefit from, that will keep the majority of our community safe, but also keep open up and get people back to work and back to COVID normal as soon as we can.
Doctor, if I could ask you a question about the reports of a baby and a young child on ventilators in intensive care at the moment. Can you confirm that, and do you have any further information that you can provide on those cases?
Yeah, we have reports of 3 children in intensive care at the Children's Hospital. This is in context, though, of over 2,000 people approximately who are children being cared for by the Children's Hospital Network. So unfortunately, but rarely, people, including children, do require intensive care. Overall, children do very well and with COVID, but there is always a spectrum of disease of any age group. Yes.
How many paediatric ICU beds do we have in New South Wales?
Gosh, I don't know the answer to that. We'll have to get back to you on that one.
Do you have any further information around the 3 people who sadly died, particularly when they tested positive to COVID?
I may not have it with me, but the people who, I'll just repeat the information I have. A woman in her 50s from Western Sydney who died at Blacktown. She received 1 dose of vaccine and had no obvious comorbidities. A woman in her 70s from southwestern Sydney who died at Campbelltown Hospital. She was not vaccinated and had significant comorbidities. And a man in his 70s from southwest Sydney who died at Liverpool Hospital. He was not vaccinated and had no significant comorbidities. We'll have to get back to you about further information.
And the woman in her 50s, no significant underlying health conditions, that's a concern?
Yeah, that's our understanding at this point. And again, it shows the spectrum of disease that can occur in people who are otherwise well. Now, the more comorbidities you have, sadly, the more likely you are to get severe disease. And it just goes to show the message about vaccination is just so important, not just for yourself, but if you're living or have close contact with elderly relatives, friends, it's really important that you get vaccinated to try and minimise the risk that you'll be transmitting to other people.
Let's talk about Friday. Would you mind just precisely explaining what has changed in contact tracing? Have you ended phone calls in the first instance because of the number of cases?
No, so we are still, contact tracing is a very important part of COVID control, along with vaccination and the social measures that we've been talking about. But as numbers increase of cases, it obviously stresses the system. And so we've been streamlining the processes we've got for case investigation and contact tracing, where have been the last several days or so been using text messages for cases to give them clear information about what they need to do in terms of staying at home, isolating, caring for themselves, seeking additional care where necessary. We've got advice about what they should be saying also to their close contacts. We still have a very robust contact tracing system. But in addition, we have been streamlining the ways in which clinical teams can then be aware of and care for patients newly diagnosed with COVID. So it's a robust system that we work through across the health system, both in public health, the clinical team, and of course working with police, who are also offering welfare support to patients.
Can I ask you a question about rapid antigen testing, please, and a follow-up, please, for the Premier as well? We could probably show you a montage of questions asked by journalists 2 months ago, to which your response and every politician in the country's response was PCR is the gold standard, and yet now we are rolling them out. To what extent is the slowness of the government bureaucracy hampering our ability to get on top of this crisis? Why is rapid antigen testing, why is it in the trial phase? Why is there a trial? This was happening 6 or 7 months ago overseas. We could see it was going to happen. Why are we continuing to trial instead of just doing? And the same question for the Premier, please.
Rapid antigen is actually being used, has been for the last few weeks. With every new disease, and we don't get them that often, but we do get them occasionally, there's a development of technology that allows us to diagnose the disease. That technology has been rapidly developed through this pandemic, including the use of rapid antigen testing. The most appropriate tests for...
I need to stop you there. The same technology available today was available a year ago.
And
the policy was able to be adopted months ago, but it still hasn't. Why is it taking so long?
Yeah. The most appropriate technology for, it depends on the stage of the epidemic you're in. In a situation where we're wanting to find every single case quickly, PCR is the gold standard, as we've said before. In situations where we get larger numbers of cases, where we're trying to get a better handle on the risk in various industries, use of alternate technologies like rapid antigen tests, which have more limitations. They're less accurate, they have false positives, they have false negative results.
Mary Louise McClaws, esteemed epidemiologist, says that one is a diagnostic tool to diagnose exactly what you may well have, and rapid antigen testing is a screening tool. Weeks ago, we adopted a policy of screening workers who had showed no symptoms just to be able to leave their LGA, and that had to be done every 3 days. Why was rapid antigen testing not ready then, before the health system became totally overwhelmed, to the point where contact tracers can no longer keep up?
So the rapid antigen testing has been the part of a suite of technologies available for use for testing. Now, we've had huge capacity for PCR testing within New South Wales and across Australia. That continues. We run up to 150,000 tests a day. But with new technologies like rapid antigen testing, and with knowing its limitations, you have to roll these things out carefully, because we don't want to be in a situation where we're giving false results, positive or negative, to people when it really is important that we know the accurate result. So as part of any new suite of tests, including rapid antigen testing, we have to have safeguards, good clear clinical oversight, good clear procedures, good clear ways of verifying the test results. So there's a range of things that need to happen before we can just willy-nilly introduce new technologies.
And the same question for the Premier. Sorry, James, just the last. Rapid antigen testing.
The issue is all the health experts advise the rapid antigen testing isn't as accurate as the PCR testing. But rapid antigen testing...
They screen different things, Premier. They screen different things.
Yeah, I'm about to answer your question, if you
Okay,
let me.
thank
Thank you. But the issue is the following. When you have a high rate of vaccination amongst the community, rapid antigen testing has a very good place at workplaces, at other places where that's appropriate. But know that it's nowhere near as accurate as PCR testing. When you're in the middle of an outbreak, you want to make sure you have accuracy, you have timeliness when people are positive, and that's why PCR testing still has a major role in how we deal with this outbreak. But into the future, when we have 70% double dose and 80% double dose, rapid antigen testing has a very important place or role to play. It is less accurate, but when you have that coverage in the adult population, this is why I'm explaining the context from a public policy perspective. But if you've got the gold standard testing, yes, it might take extra bit of time to get the result, depending on where you are. But the testing we are doing in hundreds of thousands of people in a couple of days. Every day we're seeing over 150,000 people get tested in the traditional way. That gives us good accuracy. But into the future, we're going through a transition where rapid antigen testing definitely has a role, but you wouldn't want to do that in the middle of an outbreak because it's not as accurate. There are too many false positives or false negatives, as Dr. McAnulty has explained. So there is a role for rapid antigen testing, especially in workplaces. Yep.
Sorry to follow up. No one's suggesting replacing PCR
Right.
testing with antigen testing. This is a question of whether you can screen people who are asymptomatic before, twice weekly, like they do in the UK, before they go to school or work. The settings were so onerous that you had to scrap a policy for business to use it, and much of it relates to the TGA ruling, which means that you need a health
Right.
practitioner.
Exactly.
Can you just provide a clear answer? Should that TGA ruling be scrapped now?
You're asking me as to whether I should overrule or anybody should
I'm not asking you
overrule.
whether you should overrule it. Would you like the TGA to scrap
That's
that ruling?
not a matter for me. The matter for the states is to
It's your
follow
opinion,
what
Premier.
the matter for the states. You're asking a very inappropriate and unfair question. The states have to react to what our federal health authorities just tell us in terms of what is safe, what is acceptable practice in Australia, and we all rely on that information. And if we didn't rely on that information, we'd all be going off making stuff up on the run, which isn't what should happen. But there is a place for all these type of things, but we have to accept that we are going through a transition. Once you hit those high rates of vaccination, we will change the way we do things. You won't need that invasive PCR or that PCR test necessarily. Although in certain settings you will. That is the most accurate, it's the gold standard of tests, and it should always be used. But to the extent that you can use rapid antigen testing, for example, if you have a fully vaccinated workforce but want to make sure that nobody's bringing disease onto your work site, that is a very good way to do that. So there's all these options from a public policy point of view, which we consider the health advice as it comes, but we also have to accept that things will be done differently once we hit 70% double dose and 80% double dose. It is a good backstop though. If you only have a worker who's on one vaccine dose and hasn't been fully vaccinated, rapid antigen works really well as a backup. It's not as good as the PCR test, but it obviously works as a really good backup. And that's where it should be used, and that's where we're adjusting our policy settings to as well.
Very slowly. Very slowly.
Great, thank you.
Thank you.